the biggest differences between the digital approach to all-in-4 and the conventional approach to all-in-4 is that we are really working more hand in hand with a lab before surgery. Our lab comes to the office with us and helps us to do photogrammetry, three-dimensional photographs, and our CT scan, our intraoral scans. All that data is acquired, shared with the general dentist. Sometimes the general dentist will do the scans himself. Then we do a smile design where I may or may not be involved, but certainly the dentist is involved with that, along with the patient collaboration. So the patient gets to see a mock-up of what they can look like with this procedure. All that information is then stored on the lab computer. Patient comes to surgery, we do the procedure, we place the implants, rescan the patient, and that data is then layered on top of the previous data, and the lab will then take that smile design, make that match up, and mill a custom bridge based upon that particular design. The advantage is you get an improved patient outcomes because the patient can visualize what they're going to have before surgery, and also the results are more predictable than the conventional way where we were taking impressions and doing model surgery. So it's definitely an improvement. Everybody has a story about their favorite patient that they were able to help with all-in-4. And I would think one of my favorite patients is a lady by the name of Jackie. Jackie was a former implant patient of mine back in the late 80s and had multiple implants placed. Unfortunately, she went through some hard times, had some financial issues, probably wasn't taking the best care of herself, lost a number of remaining teeth, was having some issues with the remaining implants. She came in and needed some help, and I said, Jackie, this is not something we can fix with conventional dental implants. We're going to need to do an all-in-4 technique. When I explained that to her, she immediately wanted to do that. Finances were concerned for her. We were able to help her with some financial situations there. And when we finally delivered her prosthesis, her daughter looked at her and said, Mom, you look like you looked when you were 30. You know, that's a great thing for a patient. This is a lady in her 60s who's just really had to struggle. And now the tears rolled at that point.